What are risk factors for chronic Lyme disease? I'm Dr. Daniel Cameron. I'm going to be addressing this question that I commonly see in my practice. So let's begin. Some patients don't fully recover from Lyme disease. They have a broad range of symptoms: ongoing fatigue, pain, sleep problems, neurologic changes, emotional strain, and disrupted daily life. That can also include school, being a parent, and a coworker. There's a variety of common chronic Lyme manifestations that show up. There's a musculoskeletal group where they have chronic arthritis, muscle pain, stiffness, and tendon inflammation. There's a neurologic and psychiatric problems with post-treatment Lyme disease syndrome being more controversial because I consider it a potential infection instead of a syndrome. Brain fog, memory issues, neuropathy, sensory issues, depression, irritability, mood swings, and PANS. Also, from a cardiovascular perspective, there's dysautonomia, including POTS, Lyme carditis, arrhythmias, chest pain, dizziness. And there's a variety of other chronic Lyme manifestations, including sensory overload, which could include light and sound sensitivity, heat and cold, sometimes smell. This could be related to dysautonomic issues that are related to Lyme disease. They can persist for months to years. Now, the key contributors to chronic Lyme disease need to get worked out in terms of a formal assessment of what is a risk factor. But what I see in my practice is that if there's a severe initial infection with neurologic Lyme, meningitis, or carditis, I keep alert. If there's treatment delays, I've had treatment delays for months and years in my patients that I see. And if there's early systemic involvement, like widespread symptoms at the onset, fatigue, pain, neurologic symptoms, or loss of function. I also find that co-infections like babesia and multiple other tick-borne pathogens play a role in contributing to chronic Lyme disease issues. And reinfections, relapses are also important. If they've had a history of relapses, I'm going to be on the lookout for chronic Lyme disease issues. So the key message is for healthcare providers is that it's important to screen for these risk factors that need to get worked out. Monitoring with co-infections I find is helpful. I monitor high-risk patients or patients who relapse for possibility of chronic issues. And I don't dismiss the persistent symptoms, even if they don't have a formal diagnosis yet. And for patients, early treatment is crucial. I advise them to see their doctor early, and if they don't resolve their illness, to go back for a second opinion or find a doctor who's experienced in treating chronic issues related to Lyme disease. Look out for co-infections because they complicate the recovery, particularly babesia because it can mimic conditions like menopause. Persistent symptoms are real and can lead to chronic complications, but advocate for comprehensive care for yourself and for your family. Thank you for joining me. Please share your questions and comments below. I'll read them all and respond where I can.